Have you ever wondered why we need to adopt a healthier lifestyle as we get older, or why we may be susceptible to gastrointestinal disease, such as diverticular disease? Diverticular disease, also known as diverticulosis, is the presence of sac-like outpouching of the lining of the colon that protrudes through the outer wall. These diverticula form as a result of increased intra-abdominal pressure and are commonly formed in the sigmoid colon. Blood vessels supplying the affected area would be separated and predisposed to rupture. This leads to blood getting into the large intestine and eventually into stool. Diverticular outpouchings are divided into true and false diverticulum. A true diverticulum is congenital and usually presents in infants, whereas false diverticulum are acquired and can be seen in the adult population. Asymptomatic diverticulosis is painless. However, there can be symptomatic diverticulosis leading to distinct painful symptoms such as pain at the sigmoid area. Normally, painful diverticular disease often coexists with inflammatory bowel disease, which may lead to misdiagnosis. Hematochezia can be a sign of a ruptured blood vessel, which presents as blood in the stool. A different way in which diverticular disease can also present is through diverticulitis. Diverticulitis is essentially an inflamed diverticulum, which is thought to be due to the fecal matter lodging at the opening of the outpouching, causing the gut bacteria to initiate an inflammatory process. This is thought to be less common, as inflammation is primarily associated with erosion of diverticular wall due to the increasing pressure coming from the constant contractions. Diverticulitis commonly presents with symptoms of nausea, fever, tachycardia, pain in the left lower quadrant, and also loose stools. Now let's take it one step further with diverticulitis. This is a slightly challenging approach in which your immunity is insufficient to contain the inflammation. Studies have shown that 1% of immunosuppressed patients had increased incidence of diverticulitis in comparison with the general population with 0.02%. The severity was also much higher. It is therefore highly recommended that if you show all common symptoms such as abdominal pain, to take a CT scan to distinguish complicated from uncomplicated diverticular disease. Risk factors leading to diverticular disease include diets low in fiber, leading to constipation, also carbohydrate-rich foods and red meat, which increase the risk of painful symptoms. Age is one of the most common factors, with the majority being adults over the age of 70. NSAIDs such as aspirin can promote blood loss from existing ruptured arteries in the gut. There are also genetic disorders such as Marfan syndrome and Ehlers-Danlos that affect connective tissue. Diagnosis may include barium enema, which is an X-ray exam that can detect diverticula, a CT scan, colonoscopy, and laboratory FBC and CRP tests that are used to identify the presence of inflammation. Management and treatment is divided into medical and surgical, where medical involves high-fiber diet and drinking more water, but in cases of exacerbated diverticulitis, there may be need for intravenous antibiotics, analgesics, and fluids in hospital. In more severe cases, the best option would be complete removal of the colon.